We're covering the muscle system, and we're covering skeletal muscles on a left leg on the posterior side and looking at the thigh muscles. So I'm going to show you these 6 muscles with the key in a little bit, but as I go through them, test yourself. I know it's a picture and different pictures are used in different classes, different models, different charts, but it's good to practice them. I've been teaching anatomy for about 25 years now. Sometimes just speaking the language and learning the terms associated with picture helps you to learn the material. Let's go through these muscles and we'll look at our primary muscle of our buttocks, our gluteus maximus, by weight or size from mass. It's our largest muscle in the body. Our smallest are in our inner ear. The gluteus maximus. As I come down on the medial side, because this was a left leg, the most medial muscle here, number 5, is gracilis. The most medial muscle is gracilis. And often deep to gracilis is adductor magnus. So number 2 here is adductor magnus. If I continued on the anterior side, you'd see adductor longus, pectineus. So this is adductor magnus. And then these 3, 4, and then 6 and 3. These 3 are all of my hamstrings. So hamstrings, the most medial one, I remember with the M in semimembranosus, the most medial, semimembranosus. The one on top is semitendinosus, T for top, and tendinosus, semitendinosus. Number 4, biceps femoris, but this is the long head, biceps femoris, long head. You can see a little bit of short head on the side here. This is the short head. I would have to take off or disarticulate the long head to see it. Some models you can turn it, still see a glimpse of it. So our hamstrings, biceps femoris, long head, semitendinosus, and semimembranosus. You can also see just a little bit of tensor fasciae latae on the lateral side here because it's got that IT or iliotibial band. So let's look at our key here. How did you do? We said gluteus maximus. If we said this was tensor fasciae latae, but we work our way over with our hamstrings, biceps femoris, long head, semitendinosus, semimembranosus. As I go on the medial side, the most medial, gracilis, and underneath, adductor magnus. Now let's talk about origin, insertion, and action. Remember, our 2 attachment points are the origin and the insertion. The one that more movement is insertion, less movement is the origin. And then what does it actually do? I try to put them together in segments. When we look at gluteus maximus, remember the iliac crest is that top ridge over the ilium. So it attaches to the gluteal side, the sacrum, the coccyx, and I get down into my vertebral column, so it's helping with overall movement. If this is the largest muscle by mass, we have to have large attachment points to the ilium. It drops down to the gluteal tuberosity of the femur and then at that IT band or tract. So what do I use it for? It's that extension and movement of the hip or abduction of the hip as well. Okay. It's the primary action that we're talking about because, when you do squats, you're using that to extend your hip. Adductor magnus, when we look at our rami, remember we said our ramus has a superior pubic ramus and an inferior ramus, and then I go down to where I sit at the ischial tuberosity. So it originates there, but we find a lot of our different muscles will come down and insert at the linea aspera, that rough line at the posterior side of the femur. So we attach to the femur, and then we have more movement of the hips, or we're adducting, we're flexing and extending. When we look at our hamstrings, semimembranosus, semitendinosus, and biceps femoris, you see the same origin of ischial tuberosity. And then we get into seeing linea aspera, the femur, because that's our largest bone. We can use it for a lot of our attachment sites. When we look at where they insert, medial condyle of the tibia, medial surface of the tibia, medial surface of the tibia. So we insert down at the medial side of the tibia. And why are we using it? We flex the knee and extend the hip. So you can start to put some of these OIAs together and think about collectively the group of them, of the hamstrings, and how we organize them will have some of the same or similar origin insertions. And then if we group them, they definitely have some of the same actions. So remember, as you go through these, try to think about where they attach and how that will help you with an action. In review, gluteus maximus, adductor magnus, semimembranosus, biceps femoris, gracilis, and semitendinosus. These are major superficial skeletal muscles on the posterior side, and we're looking at a left leg.